do wear your masks properly. The Chief Executive. Fellow citizens, friends from the media, good morning. Since the 15th of April, when I had the last press briefing to fight the epidemic, it's been 10 days. We are pleased to see that in the past 10 days, the COVID-19 epidemic has further eased. According to the number of confirmed cases announced by the Department of Health, whether confirmed by PCR or RAT, starting from the 15th of April, we're still having a 3-digit number of cases per day, and there is also a declining trend. While we wish to see a more rapid decline, still the trend is an important indicator. On the 25th of April, i.e. yesterday, we had 431 confirmed cases, down more than half compared with 946 cases we had on the 15th. As regards other indicators where we used to monitor the state of the epidemic, we have seen quite substantial fall as well. For instance, now we're doing a sewage surveillance program for the whole territory. The viral load per capita dropped from 68,000 units per kg on the 15th to 26,000 as at yesterday. As regards the restriction and testing declaration as a result of the surveillance program, now the percentage dropped from 0.73% on the 15th to 0.23%, down about 70% as at yesterday. As regards our compulsory testing notices, the number of the percentage of positive cases dropped from 0.61% to 0.32% from the 15th to the 25th, down almost half. Now, if you look at research findings from Hong Kong U, the immediate effective reproduction rate, the latest figure was obtained on the 17th, and that is towards the end of the Easter holidays. There was no rebound. It was still 0.4736. As regards the daily rate, yesterday it was even lower. It was 0.08%. That is 8 out of every 100,000 people in Hong Kong. 10,000 population in Hong Kong. Regarding those being treated at hospitals, we had 2,002 patients still being treated in hospitals, but you have to bear in mind that in the past 10 days, the HA has changed its definition. Positive cases will be regarded as a recovered patient after 28 days from COVID-19. They may still be in hospital for perhaps other underlying diseases. Now, for patients being treated in ICUs, there are 16 now. A substantial drop from the level on the 15th. These good signs allow us to follow the program announced on the 21st of March. So we have done the following things, and that is to gradually resume normal operation in Hong Kong, allow us to resume to normal life. Now, on the 19th of April, after the Easter holidays, schools started to resume face-to-face classes in phases. As at today, about 600 schools covering almost all primary schools and secondary schools, and of 315,000 students have returned to face-to-face classes. They are doing RAT as required by the government on a daily basis smoothly. Another areas, of course, the yearly DSE, HK DSE, started on the 22nd of April smoothly. At Penny's Bay Quarantine Center, we set up a dedicated examination center, and about 30 students took their DSE examination there. Another measure is, of course, the first stage of relaxation of social distancing measures. They were rolled out very smoothly on the 21st of April. In May, we have further important decisions to make, including relaxation of the second stage relaxation of social distancing measures, and secondary schools announced that after the HKDSE, then gradually face-to-face classes can resume in secondary schools. Last week, we announced a number of measures. Non-residents of Hong Kong can travel to Hong Kong by air starting from the 1st of May, and we've also revised the flight suspension mechanism. So we have gradually put the epidemic under control, and that have brought positive impacts, and so we can roll out our plan, and so that our life can resume to normal in Hong Kong. However, we still need help from the community in vaccination. After such a long time, we've seen that the vaccination rates among the elderly and the kids are still not satisfactory. For those who are over 75 years old, only 74% of the elderly have received the first jab, and those aged between 3 and 11, only 66% have taken the first jab. In other words, in these two age groups, we still have about 400,000 persons waiting to receive the first shot. Of course, we are now already talking about the second booster. Elderly or senior citizens, like myself, have already taken the second booster. And if we still have 0.4 million persons in our community among the elderly and the kids who have not yet taken the first jab, this is worrying. So I appeal to family members of the elderly and young children to take the first jab as soon as possible.
The floor is now open for questions. Please raise your hand and identify your organization before you speak. Since time is limited, please restrict yourself to no more than 2 questions, and no follow-up questions could be asked. The lady on the front row, please.
We would like to ask a question from SCMP. So do you see the recent commentaries from People's Daily and other state media on sticking to zero COVID a warning against further easing the border control measures or social distancing? And will you consider further lowering the flight ban threshold or easing the social distancing restrictions, given there is no rebound of infections following the Easter holiday? And second, you have repeatedly say that Hong Kong's press freedom is not under threat. But yesterday, the FCC becomes the latest body to have withdrawn from a human rights press award. And a former university scholar known for outspokenness in the press has also left the city. So given the uncertainties, how can it be said that Hong Kong's press freedom is still thriving? Thank you.
First of all, I have repeatedly said during the last 2 years of fighting the epidemic that the situation has to be continuously reviewed, and the right decisions have to be made, trying to strike a balance between the public health considerations, the socio-economic development needs, and the people's tolerance and acceptance level. So with that in mind, the government has to continuously adjust its policy measures, and that's exactly what we have done. It is gratifying to know that after more than 3 months since the 5th wave of COVID-19 hit us hard in Hong Kong, we are on the road or on the path to returning or resuming normal activities. So as far as social distancing measures are concerned, we will continue to press ahead with the 3-stage relaxation that I have announced on the 21st of March, unless there was a sudden surge in COVID-19 infection cases. But that looks quite unlikely based on our observations and the experts' advice because of the high level of hybrid immunity that Hong Kong has achieved. So we have effectively and successfully rolled out the first stage. And I noticed that many Hong Kong people, many restaurant operators are very happy with this first stage relaxation. So the second stage is intended to take place about a month from the first phase. That is maybe the second half of May. So this is the plan at the moment. As far as border controls, these are still very important measures in order to reduce the importation of infected cases into Hong Kong, especially when many places are already removing their restrictions and social distancing measures, etc. So we still have this policy to prevent and reduce a large number of imported cases into Hong Kong. But again, using my analogy of trying to strike the balance between the three factors, we have made certain adjustments and announced them last Friday to take effect mostly on the 1st of May. So for the time being, we don't have any further plans to further relax the border controls or the flight ban or the flight suspension measures that we have put in place. About press freedom is one of the rights and freedoms enshrined in the Basic Law. And in the last 25 years since reunification, all these human rights and freedoms have been safeguarded and upheld in the Hong Kong Special Administrative Region. But from time to time, there would be some concerns and worries arising from isolated incidents. So I would say that the two examples you have given are those isolated incidents which might have given people that impression, especially people who tended to misunderstand the constitutional safeguards for press freedom. And that is, one has to observe the law in exercising your freedom. So I have no particular comment on those two incidents that you have quoted, because the first incident is an award event which was organized by a private organization. If that same organization decided not to hold that event, a government official could not comment on it. The answer has to be given by that particular organization. And the second incident is about people leaving Hong Kong, whether for good or for a short while. This is in exercise of individual freedom to enter and to exit Hong Kong. Again, it is a right enshrined in the Basic Law. Thank you.
下位記者提問。後
Next question, please. The lady on the back row, please. Good morning, this is TVB. The daily caseload is some 400 cases in terms of social distancing measures and the relaxation of travel from non-Hong Kong resident inbound travelers. Does it mean that it's no longer realistic to achieve 0 cases? Are you going to pursue compulsory universal testing? And given the relaxation of social distancing measures, would some of the isolation facilities be closed down or suspended? Like I said, over the course of the pandemic, we have to consistently review the situation in Hong Kong. And we must consistently evaluate the measures to be taken by the SAR government. And in the process, we must consider the social economic impacts, or else we would have to pay a very heavy price. Meanwhile, we must also consider the acceptability of the public as well as public health needs, especially if the virus could have far-reaching consequences. So we must continue to keep tabs on the situation, and we would make an announcement at an appropriate juncture. As for the current community isolation facilities, with the support of the central government, their capacities have been reinforced significantly. And like we announced earlier, for these community isolation facilities, for those who could be returned, or for those who could resume their ordinary use, they will be given priority. These include the public estates, which would see a population intake soon. They would be returned first, and some other facilities would be returned to non-governmental organizations who would use these facilities to help some families. Currently, the Penny's Bay isolation facility is for use by DSE candidates, and the capacity is well under the limit. Even if we have 50,000, well, only 30 DSE candidates needed to take the exams at Penny's Bay so far, because they tested positive that morning. From May the 1st, non-Hong Kong residents will be allowed to travel to Hong Kong. And that is why we have seen more bookings of quarantine hotels recently. But the hotel occupancy rates are only at 60 to 70%. Some hotels might be more fully booked than others. As to whether we can vacate some isolation hotels and convert them into quarantine hotels, the answer is yes. Earlier, we converted 20 hotels which were used as isolation facilities into quarantine hotels for inbound travelers. And in May, we will convert another 9 isolation hotels into quarantine hotels, which will provide about 3,000 rooms. And after that, not many hotels will still be used as isolation facilities. Some hotels have been handed to the HA as quarantine facilities for staff under close chain management, together with the Phase 1 facilities at Penny's Bay. Altogether, there are 7 sites for community isolation facilities. To achieve better cost effectiveness, these facilities would be concentrated in a particular area, and the Secretary for Security is conducting the work. And in case Hong Kong sees a 6th wave, we will still have the capacity to fight the pandemic. Thank you.
One last question. The lady at the back. Good morning, Mrs. Lam. I'm from Commercial Radio. You mentioned that the vaccination among the elderly and the very young kids were not very satisfactory. Will more incentives be provided to encourage vaccination? And some experts say that the flight suspension mechanism is not very effective in epidemic control. And if we are to persist in this mechanism, we may stand to lose more. And 20 flights have triggered this flight suspension mechanism. Will you review the mechanism again? Now, for vaccination, we have done our level best. Our experts have helped us to appeal very hard to the community, and a lot of data have been provided to show the difference in emergence of serious conditions, the need for hospitalization and death between those vaccinated and unvaccinated, and the contrast is very obvious. And we've also provided outreaching vaccination service as well. Compared with other countries, I think we have an all-round approach in helping members of the public to get vaccinated already. Our greatest incentive now is the vaccine pass. If you are not vaccinated, you cannot enter quite lots of premises. To us, the end of this month, under the vaccine pass, people have to have received 2 shots, and then by end of May, 3 jabs. This is already a great incentive. If you're not vaccinated, you can't eat out in a restaurant, go to the cinema. And if people still don't want to be vaccinated, we don't know what else can be done. Of course, some say that we should pay out cash. Then it will be among the very few in the world to use money as an incentive for vaccination. Nor do I believe that it will be effective. So I continue my appeal, and I hope the media can help. I hope you can show that the responsibility of the media. Use objective facts to use your very persuasive reporting to appeal to the public. While we have this window with easing of the 5th wave, do get vaccinated so that ability to fight the epidemic will be much stronger should the 6th wave come, and the opportunity of closing down premises will still be lower. Hong Kong is an important aviation hub. In particular, in this time of government, we have spared no efforts in developing Hong Kong into an international aviation hub. Now, under the 14th Five-Year Plan, we have got the central government support to be a world aviation center. And in the GBA, we've also got the central authorities support so that our airport can be in synergy in development with the Zhuhai Airport. The epidemic will bring us a short-term impact. I believe after the epidemic has stabilized, and as we relax our measures to guard against importation of diseases, I'm sure we will see our international airport returning to its previous robustness, and we will be attracting more flights to come to Hong Kong for transit and as a destination. So we'll continue to do this. Thank you very much. The press briefing ends here. Thank you very much.